Continuing with our educational videos, happy Halloween. You might be seeing this later in November because we're filming today on Halloween, but happy belated Halloween. um, Question a lot of people ask is um, what is the best food for the dog? And definitely in our clinician experience is more of a consistent balanced diet on the dry or wet foods. Certainly the dry has a little bit more benefits with the amount of calories, the probably helping a little bit with keeping the teeth a little bit cleaner, and how long we can have it around for. I mean, it definitely has a longer shelf life, especially after it being open, for example, in a canned food. Not too horrible on the canned food, but the canned food you have a higher water content that you're buying water in other ways, and then you also have a little bit more of issues potentially with making sure that we're keeping the teeth clean. And there could be, depending on how much we're varying it, there could be GI upsets that can happen more with the wet foods. Definitely the veterinary community or profession doesn't like we for several reasons. The main one, parasites or bacteria control in raw diets. So definitely consuming for us or for dogs diets that are not well cooked could present a problem for us or the dogs. Another question that we commonly get is are we feeding my dog a grain-free diet? And there was a, a bandwagon where everybody was jumping into grain-free. We thought that grain-free was a good thing. And there has been some research lately that documented in some breeds that we were not seeing heart disease, the onset of heart disease based or pointed or pinpointed to being the grain-free diet. So unless your veterinarian hasn't made it a point or make it a conclusion that we need to have or try a grain-free diet on your dog, you don't necessarily go to a grain-free diet. I would say try to stay away from them. Ideally, you want to choose a diet that has life stages: a puppy food, adult diet, and a senior diet. You don't want to be with a diet that is all stages because there are stages of life. Puppies have different needs, especially large breed puppies, where you even have small breed and large breed puppy foods because they both have a little bit of different requirements as they're growing. The adults have their requirements, and then as you get older, the dogs start passing 7, 8, 9 years of age, around the 7, 8, you want to have them on a senior diet that is going to help a little bit more the liver processes and the kidney processes. So definitely a diet that has the stages of life. My recommendation always has been to stay away from anything that is not the dog's food. In my clinical experience and my own pets, I have experience where if we are not feeding anything else that is not their diet, they're typically healthier, their coats are thriving, shinier, their bowel movements are more constant and routine and formed, versus when we are changing or adding multiple treats all the time, things that are consumable or chewables that are consumable, and table scraps or people food, if you will. So I would stay away from any of those. In general, for a healthy animal, healthy dog, you can choose. There's some multiple dog diets out there. I would keep an eye on them to that they are having life stages for them. I would also look that they're following some recommendations from AFCO. Usually, this shows it on the label. And for the majority of them, most of them out there are good. Prescription diets are for dogs that have been diagnosed with certain conditions: renal, hepatic, cardiac, allergies. Depending on what's going on with your pet, then a prescription diet might be recommended. Not that they're better or worse than the diets in the supermarket or wherever you get them. It's just the prescription diets are mainly focusing on a condition that your pet might have and is being prescribed by a veterinarian. In general terms, you don't have to be giving your pet an additional vitamin or a supplement. If they are in a balanced diet, if they are eating well, um, they are not having any other condition or any other reason that the veterinarian may be recommended a vitamin or a supplement, there shouldn't be any need for that. The same as us, if we're eating a balanced, good diet, then we don't really need to having a supplement or a vitamin. Now, there are other situations where a vitamin might be recommended or a supplement might be recommended, so I would just follow the advice of your veterinarian.